Hi, my name is Kara Landon. I'm going to be doing a head-to-toe assessment of you today. How are you?
Good, how are you?
Fine. Okay, as she was walking into the room, I would have made note of her appearance, her gait, the way she's dressed, if she's dressed appropriately to the weather, the way she's walking, if she's having any problems, if she's having to use any assistive devices, anything like that. So I'm also going to be looking at her personal hygiene, making sure she looks clean, well kept, no odors coming out of there, no involuntary movements or anything like that. She's making good eye contact with me. Her affect, it looks fairly interested. But she's engaged in our conversation, and obviously she's able to hear me because she's not asking me what. She can hear normal voice tones. Okay, so basically what we're going to be doing today is, like I said, just doing a head-to-toe assessment. I'm going to start with visual inspection. And all through the assessment, when I'm assessing every part of her body, I'm going to be looking at her skin color, tone, texture, looking for any bruising, lesions, swellings, tenderness, anything like that. Okay? I'm also going to check like her nutritional status, make sure she's not malnourished or anything like that. So, okay, so I'm going to, first of all, I'm going to look at her hands and her arms. No redness, swelling, no bruising, no edema. I'm going to check out her nail beds, they're pink. No evidence of clubbing. Check her capillary refill. Less than 3 seconds. Okay, and everything I would do on one side, I would do on the other, but for time constraints, I'm just kind of going to just do one side at a time, okay? So, next I'm going to start inspecting her head and her face. I'm doing a visual inspection of her skull, looking for symmetry, no obvious deformities, no obvious lesions, lumps, bumps, depressions, or anything like that. Okay. Then I'm going to do palpation. And while I'm doing this, I can engage in some conversation. Can you go ahead and tell me your name?
Cassidy Landon.
Can you tell me where you are?
Home.
Can you tell me the year?
2014.
Okay. I'm going to check her scalp out for any obvious or any lesions, lumps, bumps, parasites. I'm also going to be checking her hair for the texture. Smooth, it doesn't look overly dry or overly oily. Okay. Can you tell me the president?
Barack Obama.
Okay. She's obviously oriented, alert, speech is clear, everything is good there. Okay, so after I've palpated her skull, I'm going to go down to her face. I'm going to palpate the temporal arteries. Check her temporomandibular joint. Can you open your mouth for me? Close. Okay, I'm checking for smoothness, any ratcheting movements, any tenderness. Can you open your mouth? Okay. Alright, so, excuse me. I'm also going to palpate her frontal sinuses. And her maxillary. Any tenderness there? Okay. Alright, so now I'm going to look at her face. Again, inspect, looking for symmetry, skin tone, lesions, swellings, redness, anything like that. I'm going to have her look straight towards me. Her eyelids cover the upper portion of her iris. Can you close your eyes for me? Okay. Both eyelids approximate completely. And her eyelashes are distributed evenly. Okay, go ahead and open your eyes. Okay. So, excuse me. We're going to go ahead, I'm going to go ahead and test her kind of field of vision and everything like that first. So I'm going to have you cover your right eye. I'm going to cover my left. Tell me when you can see my hand.
Got it.
Stare straight at my nose.
Got it.
Okay. Alright, do the other eye.
Yep.
Okay. Alright, so we're going to check her cranial reflexes. Basically what I'm doing here is checking for symmetry of eyes. Wherever the pinpoint of light shows, it should be even on the other eye, which it is. Okay. Alright, so we're going to check the 6 cardinal positions. Okay, just follow my finger. Alright, we're going to also perform what's called a cover test. I'm going to have you cover one eye. Okay, you stare straight at my nose. Okay, so this is also checking for lazy eye. What's going to happen is whenever she uncovers her eye, I'm going to be watching this eye for any movement to center. Okay? Okay, uncover your eye. Okay, do it with the other for me. Okay? Okay. Everything looks good there. So we're going to actually inspect the actual eye now. As usual, visual inspection first. There's no obvious bulging or sunken in appearance. She's looks symmetrical. Okay, so I'm going to go ahead, watch my feet here, and check her conjunctiva. Should be pink, moist, no redness, excessive tearing, anything like that. Okay, I'm going to go ahead and check your lacrimal nose, or lacrimal ducts. Okay, there we go. Okay, sclera, I'm having you look up for me. Sclera is white, no redness or yellowing, moist looking. Okay. Your irises are round. The coloring is evenly distributed. Excuse me. Alright, so I'm going to check the pupils out. Okay. So I'm checking for pupillary response. Okay. Alright, I'm also going to check for consensual response. Basically, I'm going to check, I'm going to check, well, I'm going to shine light on this eye, the other eye should react as well. Okay. Okay. Pupils are about a 3 to 4, equal reactive, consensual. Okay, I'm going to have you watch this, my finger. Okay. Show good accommodation as well. Okay. So also, if I was in a doctor or an office setting, I would have a Snellen chart available. I would have her stand about 20 feet away, cover one eye, and read the smallest line that she could, and then whatever that line is, there'll be a grading there at the end of the line. Okay? So next we're going to go on to the ears. I'm going to visually inspect them first.
Sorry.
Sorry to be bothering you. Okay, I'm going to visually inspect the ear, noting any obvious swelling, lesions, lumps, or bumps, anything, any drainage out of the auditory canal. Okay. Alright, then we're going to use the otoscope. I'm going to pull her pinna up and back. Intertympanic membrane is a shiny, pearly white. No obvious bulging, no drainage coming from the tympanic membrane or any perforations or anything like that. Okay, so I'm going to go ahead, while we're doing this, I'm going to go ahead and do the whisper test. I'm going to kind of stand behind you and whisper a word and you're going to repeat it to me, okay?
Blue.
Okay.
6.
Uh-huh.
Maybe.
Alright, so next we're going to inspect your nose. Again, I'm going to visually inspect. It's symmetrical on your face. Its size is proportionate. No obvious drainage or anything like that. I'm going to check for patency. Can you inhale? Okay. Alright. So I'm going to look up in your nose. Basically, I'm going to check for any deviated septums. While I'm in there, I'm going to look at the terminates. Make sure they're moist, pink, no redness. Okay. A lot of hair going on there, but I'm just kidding.
Funny.
Okay. So, everything looks good there. We're going to go ahead and inspect the mouth. Maybe this light.
I bite sometimes, just saying.
Alright. Okay, open your mouth wide for me. I'm going to check the buccal mucosa first. Make sure it's pink and moist. No lesions. Okay, no problems there. I'm going to go on to the teeth. Teeth look to be in good condition. No obvious cavities. No teeth are missing. Clean. Okay, hard palate is kind of a pink to a light pink. Moist. Can you say ah for me?
Ah.
Okay, soft palate and uvula go up. And uvula is midline. Moist pink. No swelling there. Excuse me. Okay, open. Can you stick your tongue out for me? Okay. Tongue is pink. The top part is moist, or excuse me, is rough. See any lesions? Can you put your tip of your tongue to the top of your mouth for me? I'm going to look at the bottom of the tongue as well as the bottom of the mouth. Looking for any lesions. This is where cancers commonly occur. I don't see anything there. Okay, stick your tongue out one more time and try to lower your tongue for me. All the way. Checking out our tonsils. Tonsils are pink. No swelling. Stick your tongue. There we go. I can see them and I grade them as the 1. Okay, which means they're not swollen, but they're visible. Okay, so after your mouth, we're going to inspect your neck and have you sit really good and straight. Okay, your head is symmetrical with your neck. There's no involuntary movements. You're able to hold your head erect with no problems. Don't see any obvious swelling. Don't see any obvious jugular venous dissension. Okay. Okay, so we're going to go ahead. I'm going to be doing a palpation of your nodes, lymph nodes. We're going to start with the preauricular, posterior auricular, occipital, jugular-digastric, submandibular, segmental. Okay. Oh, sorry. Posterior cervical. Okay. Supraclavicular. And the deep cervical. Sorry, allergies. Okay. Alright, so I'm going to have you bring your neck up just like this, and I'm going to palpate trachea, make sure it's midline. Okay. I'm going to have you turn toward the camera just a little bit. Palpate your thyroid. Okay, I'm going to have you swallow. Sorry. Okay. Okay. Don't notice any obvious swelling there either. Okay. So I'm going to check your cranium, your range of motion. I'm going to have you put your chin to your chest. Okay, now up. To the left. That doesn't matter.
I was just following you. My left.
That's right. Isn't it? There you go. And go back for me. There you go. Okay. So we're at chest cranial nerve 11. Maybe short your shoulders. Okay. Now turn your head into my hand. All right. Very good. Okay. So I'm going to have you turn, I guess, this way a little bit. We're going to
Lying down?
no, just sitting up again. We're going to inspect the thoracic cage. We're going to look for symmetry. Basically make sure your scapula are symmetrical, shoulders are symmetrical. I'm going to check your, I'll try to get to the camera can see you, your thoracic expansion. Okay, take a deep breath for me. Very good. Okay. Let's see, and we're going to do your tactile, or I'm going to test for tactile formitis. Basically, I'm going to have you say 99.
99. 99. 99. 99. 99.
Okay.
99.
Okay, so basically I'm just checking for symmetrical vibration, which I can feel that. Okay, so you want to listen to your breath sounds. Deep breath for me. Okay. Are you pass out yet? Okay. So also I'm going to listen for several different things. One's called bronchophony. I'm just going to have you say the word 99 over and over again.
99. 99. 99. 99. 99. 99. 99. 99. 99. 99.
Okay, and then also we're going to do what's called the agaphony. I'm going to have you say the E sound over just as long as you can, okay? E. Okay. E. So, so we're gonna try one more thing. It's called pectoriliquy. I'm gonna have you say like 1, 2, 3 over and over again for me.
1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3.
Okay. All right.